Welcome to Essentials of Pharmacology for Health Professions, 9th edition, Chapter 12, Integumentary System Medications. Chapter Objectives. Upon completion of this chapter, the learner should be able to describe proper application procedures for various skin medications, identify indications, side effects, and precautions or contraindications of the 9 major categories of skin medications, explain the factors that influence the absorption of skin medications, classify drugs according to their action: antipyretic, emollient, keratolytic, enzymatic, antifungal, anti-infective, or agents to treat burns and acne. And last, identify appropriate indications of the 9 major categories of skin medications. The integumentary system, consisting of the skin, hair, nails, and exocrine glands, is the body's largest organ. It's the external covering of the body that serves to protect the inner organs from damages like abrasions, burns, dehydration, and ultraviolet or UV rays. There are many conditions that can affect the skin that causes pain, of course, annoyance, and discomfort. Skin ailments can range from itching to severe burns. Usually to treat these conditions, they are topical or local applications, but sometimes skin conditions are treated internally with oral medications or injections for systematic effects. This chapter mainly explains the topical medications. There are 9 major medication categories for the integumentary system, which include antipyretics. These are used to relieve itching. Corticosteroids. These treat dermatological disorders, which is those associated with allergic reactions. Emollients and protectants. These help to soothe any irritation. Keratolytic agents. These loosen epithelial scales. Enzyme preparations. These are used to promote the removal of necrotic or dead tissue as well as fibrous tissue. Scabicides and pediculicides treat scabies or lice. Local anti-infectives are used to prevent and treat fungal and bacterial infections. Burn medications will prevent or treat burn infections, and they're also a category for treating acne. There are factors that influence the rate of absorption of topical medication. It is important to remember the condition and location of the skin. If it's thick, calloused skin, absorption will be slower. We also want to look at heat and moisture. If it's raw, absorption will be faster. We also want to look at time for the medication to remain on the skin will vary. The type of topical used affect absorption. Gels and creams, if it's water-based, they absorb more quickly. Ointments and paste, if they're oil-based, they will be absorbed slower. Also, it's important to always review directions before administering any kind of topical medications. It's time to check your knowledge. Pause the video and answer this question, and then you can move to the next slide to see if you answered correctly. Antipyretics. These are used for itching, against itching. We're looking at the use, side effects, and precautions or contraindications of antipyretic medications. They are used short-term to relieve discomfort from dermatitis or rashes associated with allergic reactions, poison ivy, hives, and insect bites. They help to relieve itching by the use of products singly or in a combination containing local, which talks about the canes, the ending canes, C-A-I-N-E-S. Example is benzocaine or dibucaine. Local anesthetics, drying agents such as calamine lotion, anti-inflammatory agents, and antihistamines. Side effects we want to look at with antipyretics can include stinging, burning, and allergic reactions, especially with the canes. CAINES. Precautions and contraindications could be delayed healing, prolonged use, and hypersensitivity reactions. Refer to Table 12.1 for those medications. The following images show conditions that would be treated with antipyretic medications. In picture A, you see an allergic contact dermatitis reaction. In picture B, you see poison ivy. Please remember to read your patient education after each section regarding what to tell patients and instruct them on taking certain types of medications. We will now discuss corticosteroids and the use, side effects, and precautions or contraindications. Corticosteroids are used topically and systemically for allergic reaction conditions. Most are available in a variety of dosage forms and potencies: low, medium, high, and very high. It will depend on the area affected and condition being treated for the choice. Side effects, especially with corticosteroid ointments and creams used for long-term, can include epidermal thinning, increased fragility of blood vessels, ulceration with occlusive dressings, activation of latent infections, and slow healing. Precautions and contraindications would be with open wounds. The following images show conditions that would be treated with corticosteroid medications. In picture A, you see psoriasis, which is a chronic skin disorder with red papules covered with silvery scales. In picture B is seborrheic dermatitis of the face, showing crusting over of a red, scaly, itchy rash, seborrhea of the face. Time to check your knowledge. Pause the video and answer the question, and the answer will be provided on the next slide. Emollients and protectives. Emollients are used topically to soothe, soften, protect, and seal out wetness in minor dermatological conditions. Their purpose is to moisten the skin, and this is achieved by creating a lipid barrier so that it does not let the moisture out of the skin. Examples of these would be for diaper rash, irritation, abrasions, and minor burns. They're also used as first-line therapy in eczema and other conditions to reduce the need for corticosteroids or other medications. Example is Balmax, which is used to treat diaper rash. Keratolytic medications are used to control abnormal scaling such as dandruff, seborrhea, and psoriasis. They're used to promote peeling of skin such as acne, hard corns, calluses, and warts. Some side effects to look at can include irritation to eyes or mucous membranes and photosensitivity. Precautions or contraindications would be open areas of the skin. The following images shows conditions that would be treated with a keratolytic medication. Picture A, you see a common wart, and picture B, a plantar wart. We want to make sure we read our patient education, what to avoid keratolytics with and what conditions. We definitely would not want to apply them to warts, corns, or calluses with surrounding tissues. Avoid contact with surrounding tissues. Also avoid contact with eyes and mucous membranes. Use only as directed and for the entire period. And discontinue. Seek medical aid if irritation occurs. Check your knowledge, activity 12.4. Pause the video, answer the question, and then move to the next slide to check your answer. Pause the video, read the following case study, and answer the question, and then move to the next slide for the answer. Enzyme preparations. If patients are bedridden, they are sometimes prone to decubitus ulcers or pressure sores, as well as diabetic patients can develop foot ulcers. The following is important to ensure proper treatment and healing. Necrotic skin must be removed in order to promote proper healing. Collagenase or Santyl is a topical enzyme ointment that's used for the chemical debridement, removal of dead or necrotic tissue or damaged tissue of dermal ulcers and burns. In your clinical application, you see a picture there of the diabetic foot ulcer. This, as I said, is common in diabetic patients. About 15% of all diabetics will experience a foot ulcer at some point. They're dangerous because a lot of them have decreased sensation in their extremities because of the nerve damage, which means that they often don't feel the sore until it's too late. If this goes untreated for a very long time, the infection could lead to limb amputation or even death. These are going to be treated with antibiotics, enzyme preparations, and sometimes the doctor will debride the area of that necrotic or dead tissue. Best course of action is to prevent this. All diabetics should regularly have someone check their feet for developing sores, and if needed, wear shoes designed for diabetics that will help reduce the risk of foot ulcers. Let's check your knowledge on enzyme preparation medications. Pause the video, read the question, and your answer will be revealed in the next slide. Next, we will discuss the use and treatments of scabicides and pediculicides. Scabicides are caused by an itch mite that burrows under the skin. Pediculosis or lice. This is caused by infestation of lice on the hairs of the scalp, the pubic area, and the trunk. Both of these are transmitted from one person to another by direct contact or with contaminated clothing or bed linens. Sometimes concurrent treatment of close contacts is recommended. For scabicides, we want to use permethrin 5% or lindane lotion, and it must be applied according to directions on the package insert. It should be left in place a required period of time. Usually that's 8 to 14 hours, and then you want to rinse it thoroughly. Most of the time, only one application is used. Sometimes there's recommended 2 applications. Of course, the second one would be separated from the first by 1 or 2 weeks. And the second application would serve to eliminate any remaining scabies or any that were retransmitted from linens that were missed or not thoroughly washed. Pediculicides, an example of a medication of that is permethrin 1% in lindane shampoo. These are used in the topical treatment of lice infestations. Parathrins, such as Rid shampoo, these are considered safer for pediculosis, although repeat treatment after 7 to 10 days is needed. Very rarely that you have side effects with these, maybe some slight irritation, rash, conjunctivitis, dermatitis with frequent application. Of course, if it's excessive or prolonged use with oral ingestion or inhalation of vapors, may experience some central nervous system symptoms. Cautions or contraindications would include acutely inflamed raw or weeping cervices, and because lindane can be absorbed systematically following topical application, it should be avoided during pregnancy and lactation, as well as with infants, children, older adults, those who weigh less than 110 pounds, and those with known uncontrolled seizure disorders. The following images show conditions that would be treated with scabicides and pediculicides. Picture A shows scabies skin infection. Picture B is the scabies mite. And picture C shows lice infested in hair. Be sure to read patient education of how to explain to patients, following directions carefully of using these types of medications. They would definitely want to thoroughly launder clothing and bedding. Caution used to prevent accidental oral ingestion. Use caution with infants who might suck their thumbs. Inform sexual partner if the condition is present in the pubic area, and alert the school if head lice infestation occurs. Knowledge check. Pause the video and answer the question. Move on to the next slide to see if you answered correctly. Local anti-infective medications are used to treat diseases caused by microorganisms. Treatment used to treat these diseases will depend on the type of microorganism. Antifungals are used to treat ringworm or tinea, and that includes pedis, corpus, or curus, and yeast, candidiasis, such as thrush, diaper rash, and vaginitis. Antivirals treat herpes simplex, herpes zoster, and varicella zoster. And antibacterial agents are used to treat impetigo caused by Staphylococcus aureus, some species of streptococci, and MRSA, and infected traumatic skin lesions. Contraindications or caution would be applied to the use of vaginal preparations during pregnancy. Use those only under medical supervision. Some products can cause fetal abnormalities. The following are pictures of conditions that would be treated with local anti-infective medications. In picture A, you see athlete's foot. This is medically known as tinea pedis. Picture B, a body ringworm, medically known as tinea corporis. And picture C is thrush, or yeast infection of the tongue, medically known as candidiasis. Please make sure you read your patient education as to what patients should be instructed in the use of antifungals. Also refer to Table 12.2 for examples of medications for local anti-infectives. Antiseptics are substances that inhibit the growth of bacteria, or bacteriostatic. Use and treatment of antiseptics. They're frequently used to describe chemicals applied to body tissues, especially the skin. Disinfectants would be included in antiseptics category, and these are chemicals that kill. They are bactericidal. They're often too strong to apply to body tissues, and they're usually applied to items such as furniture, floors, and instruments. Major antiseptics that are used today are chlorhexidine and povidone iodine or betadine, and these are used for surgical scrubs and as bacteriostatic skin cleansers. Chlorhexidine or hibiclins should not be used on wounds involving more than the superficial layers of the skin. It's very important to rinse thoroughly after use. We want to pay attention to the side effects of chlorhexidine, and that includes dermatitis and irritation. Photosensitivity. You would have an increased reaction such as burn from brief sun exposure. Allergic reactions, especially in the genital area. Side effects of povidone iodine or betadine. This would be skin irritation or burns. Allergic reactions in all areas of the body. There's cautions or contraindications for both. Please refer to these as well as your patient education for treating with local anti-infectives. Burns are injuries to the skin and tissue below the skin that are caused by heat from flames, hot liquids, steam, heated objects, chemicals, friction, electricity, radiation, or the sun. There are different levels of severity that includes first degree, those are superficial, second degree, partial thickness, and third degree, which is full thickness. The images in the pictures illustrate the various degrees. In picture A, you see first degree burns, such as this being out in the sun, a bad sunburn. In picture B, that's second degree, where it causes blisters. And C and D are third degree blisters. These are very very severe burns, and we want to watch out for our patients for infection with this type of burns. In the previous slide, I discussed what burns are, what they are caused by, and what the classes are: first, second, or third degree burns. Treatment will include topical application of medications to prevent or treat infections. The two most commonly used agents for second and third degree burns are silver sulfadazine or silvadine and methadone sulfamide. You want to apply with sterile gloved hand. For side effects of burn medications, this can include pain, burning and itching, staining of the skin temporarily. Cautions or contraindications would apply to newborns or to patients with impaired kidney or liver function, and history of allergy, especially to sulfa drugs. Remember to read your patient education in the use of burns and how to instruct your patient on proper use of these medications. Definitely want to use aseptic technique to prevent infection. Watch for allergic reactions. Keep careful intake and output records, and keep the affected area covered at all times with cream and sterile dressing. Most everyone has experienced some type of sunburn at some point in time. We want to look at the use and treatment of sunscreen medications. Overexposure to the sun is considered to be the primary cause of skin cancer. It's the most common form of all cancers in the United States. More than 1 million new cases are diagnosed each year. UV radiation is a type of invisible light emitted by the sun. There are two types, UVA and UVB. Sun protection factor, or SPF. This is a measure of the protection a sunscreen offers. A broad spectrum UV, or both UVA and UVB, greater than 30 will help to reduce the risk of skin cancer. Protection measures that we want to look at is apply sunscreen to dry skin at least 15 to 30 minutes prior to being out in the sun. Limit your time in the sun, usually between 10 a.m. to 4 p.m. Make sure to wear sun protective clothing and use water-resistant sunscreen when swimming or sweating. And you want to reapply at least every 2 hours, even on cloudy days. Acne is a common condition of the skin. Most often it's seen in the teenage years, but it can occur in adulthood for some people. It's most commonly seen on the face, scalp, neck, chest, back, and shoulders. In treating acne medications, for mild acne, it can be treated with non-prescription topical medications. For more severe acne, it can be treated with a combination of a retinoid or isotretinoin and topical antibiotics or oral antibiotics. Retinoids taken by mouth, or isotretinoin, these are used for the most severe forms of acne and for patients who fail other treatments. Excuse me. Side effects of some of your medications for acne: benzoyl peroxide can include skin irritation, mild stinging, redness, dry skin. Cautions for benzoyl peroxide include contraindicated with pregnancy and breastfeeding, for sure. Used in patients with skin diseases, dermatitis, eczema, may increase the risk of skin irritation. Benzoic acid or paraben hypersensitivity. You want to avoid exposure to the eyes or mucous membranes because it can cause severe irritation. Table 12.3 lists medications for the skin, burn medications, and acne medications. Be sure to read your patient education for patients who are being treated with acne agents and what you would need to educate them on for these type of medications. Cautions for topical medications. There are many skin medications by prescription or over the counter, and many patients use these products without proper instruction in administration, side effects, or precautions. The healthcare professional is responsible for advising patients whenever possible to use great caution with self-medication to avoid ineffective or dangerous treatment. It is very important for both the healthcare professional and the layperson to read instructions completely before administration of any medication. Be sure to read patient education on topical medications and how to instruct patients regarding these medications. The next two slides provide a chart of mechanism of action and indications for use for the topical medications in the integumentary system we just discussed in this chapter. Now pause the video and answer the self-assessment questions. This concludes the presentation on Chapter 12, Integumentary System Medications. Thank you.